And it's really unfortunate because um, for many, many, many of us that are chronically ill, um, especially those of us that are immunocompromised or older, um, or those, that have lung disease, diabetes, asthma, cancer, um, autoimmune conditions like mine, uh, even obesity, all of these things um, have made it so that millions of us in the high risk category um, have had to retreat into our homes these last months. Um, we haven't been able to spend time with our friends, um, with our family, hug our kids. And all of us have been pinning our hopes on a vaccine. And so to realize that as Trump is declaring that, we'll have a vaccine by January, which Dr. Bright and many other experts, Dr. Fauci included, um, have all said is an impossibly aggressive timeline, and that's with everything going great, um, and there's no national vaccine plan. So um, in the few months between now and January, um, nothing is being done or has been done to figure out, even if there's a workable and safe vaccine, how do we get it to everybody in a fair and equitable manner so that it's free and accessible for everybody? That's not a solution you can just come up with on the fly. Um, so um, any vaccine that just magically appears out of Trump's pockets in the next few months, I'm not going to be lining up to take, and I know a lot of people are starting to feel that way, and that's really unfortunate because you have this 1/3 of the population that thinks that uh, any vaccine is the mark of the beast. Um, then you have the other 1/3 of the population that um, would drink Trump's bathwater if he said it would cure them of the COVIDs. Um, and then you have the rest of us that are absolutely horrified that this madman is calling the shots. Um, and now he's taking a drug that causes, potentially, can cause paranoid delusions in an already paranoid man who is mistrustful of science and mistrustful of medicine, unless it's, I don't know, some kind of witch doctor quackery that appeals to his inner tinfoil hat. I just don't even know anymore. Um, and I'm frustrated and I'm hurt and I'm worried and I'm angry for all of us in the high risk category, um, who now have to be looking at this daily dumpster fire on a weekend where almost 5,000 people died in 3 days. Um, I'm quite sure that we'll be over 92,000 dead here in America by tomorrow. Um, and there's no um, compassion or awareness or concern or immediacy. There's this dog and pony show to make it look like something's being done, but here we are months later with the same chaos, and more lies, more misinformation, more propaganda, and a president that seems to be able to decide for himself when he wants to be prescribed dangerous drugs, and this is the guy that you want us all to line up and stick out a cheek so we can all get the um, Trump coronavirus Acme vaccine special. Um, yeah, not happening. So it's a hell of a place to be. Um, our oldest is a frontline worker, works for the Amazon distribution center here. Lost two of his restaurant jobs when the coronavirus outbreak began. Um, Kid didn't let him slow him down, and got a job. They were offering a couple bucks extra an hour for hazard pay. Amazon was so. Despite the risks and my objections as a mom for his safety after hearing so many horror stories for months about Amazon's lack of concern for their employees. Um, he went to work there. Been super proud of him, um, and of course, as a frontline worker and me being immunocompromised, he hasn't been able to come in the house for a few months now. Um, it's been more than 2 months, 2.5 months now since I've been able to hug him or his brother. And so a vaccine hugely important to him too. Um, and now there's an outbreak in his distribution center here. And I worry every day that he's going to get sick. And, um, the higher rates of infections and deaths among the Black and Latino community um, is terrifying, and just one more huge glaring issue that the Trump administration pays the occasional lip service to, but most of the time Trump's when he's not um, falsely recommending dangerous drugs to the public on the White House front lawn. He's in his dirty bathrobe on Twitter, rage tweeting. So I've yet to see any real awareness or compassion or urgency from him to try to throw every bright mind in our country at what is driving the higher rates of deaths and adverse reactions among the Black and Latino communities and among the Native American communities. The Navajo Nation is being devastated. They just put out a call out, kind of an all hands on deck call out for respiratory therapists and doctors and nurses and epidemiologists. Um, they shouldn't have had to ask. Meat processing workers shouldn't be having to beg for PPE. And then we've got somebody like Trump appointee Alex Azar, our Health and Human Services Secretary, blaming the home and societal lives of meat processing workers. Of course, completely ignoring the fact that over 9,000 meat processing workers have been infected now with coronavirus. More than 50 have died. The common thread with all of those cases is the meat processing plant that they work at. But Alex Azar basically says that it's what these meat processing workers, who are overwhelmingly Black and Latino, by the way, it's what they do in their home and social lives that's making them sick. He might as well have just said, these are dirty people. So what do you expect? Um, and my son is half Latino and and a frontline worker, like I said, and the Trump administration has made it really clear that, uh, and along with many Republican state leaders, that they all see um, workers, frontline workers like my son, and like these meat processing plant workers, who are a critical part of our food supply chain and have been working despite great risk themselves, just like grocery store workers and um, pharmacist workers and pharmacy workers um, and the first responders and healthcare providers. I mean, all of these people doing, a dangerous job right now because it needs to be done, and we still can't even do the minimum, the modicum of what we should um, be doing for all of these people that are giving so much for all of us. Um, and I have no confidence that people like my son, that any of the lives of the grocery store workers that have died without proper PPE, um, the meat processing workers that have died without PPE, the nurses, the doctors who have died without PPE, the police officers that have died without adequate PPE. Um, none of these people are even a blip on the Trump administration's radar. Um, they're an inconvenience, and if you ask Trump about any of them, he lashes out and accuses journalists of asking ugly questions, because all of this is so pretty, right? So um, right now, all I can do is um, try to stay as positive as I can, try to keep my eye on vaccine research that's going on in other countries, um, and just continue to try to keep our spirits up. I know things are not what they should be right now, and so much of this seems like a never-ending nightmare. I know it does to me, um, but it's important to remember that we still have each other and that we should look out for each other, um, especially on a community basis. Um, if there was ever a time to go knock on your neighbor's door and stand 6 feet away and introduce yourself and see if they need anything, this is it. Uh, People need each other, and there's a lot of people um, that are in this high risk category that don't have anybody that can run and get them a dozen eggs from the store, or just know that somebody cares enough to check on them. Um, and if you've got people in your life that are in the high risk category who've been isolating all this time, um, please take time out of your day to call them, um, to let them know that you're thinking of them, to ask them if they need anything. Just knowing that you're not alone can make everything more bearable for another day. Um, and I worry about the people in the high risk category who have been isolating all this time, um, and are starting to feel less and less hope as the death toll rises, and um, all confidence in the Trump administration's coronavirus response has slowly bled away too. Um, a lot of people are going to start feeling really hopeless. Um, and it's more bearable when you have a support system. And I'm really lucky to have an amazing family and friends that are my biggest cheerleaders. But a lot of people don't have that, and the isolation um, right now, uh, while it's keeping people safe, the emotional fallout and damage, um, it just cannot be quantified. To be physically cut off from everyone that you love and need in your life um, is just devastating, and there's no end in sight for that process. Um, so if you can be a lifeline for one of those people, please be that. And if you go to the grocery store or the pharmacy, please, please, please wear a mask. I know they're hot. I know they're irritating, but masks work. They don't only protect you, but they protect people like me or your grandmother or your neighbor, your teacher, your sister, um, your uncle, um, and people you may never meet. So um, look out for each other. Uh, Stay safe. I love you all. Um, and we'll get through this together somehow. Take care.